I think we are at a tipping point right now.
The mental health toll the Maui wildfires left behind.
It was a shock. I definitely did not expect it to be cancer.
A testicular cancer survivor shares his warning for other young men. And new research probes whether artificial intelligence may be affecting human brains. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We begin with the nation's federal health officials and vaccines. President Trump's nominee to lead the CDC testified at her Senate confirmation hearing this past week.
I have not seen a causal link between vaccines and autism.
That is Susan Menares, and if confirmed, she'll report to Health Secretary Robert F. Kennedy Jr., who has for years promoted a debunked link between vaccines and autism. The day before, Kennedy faced a House Health Subcommittee where he defended the changes to COVID vaccine recommendation.
We're not depriving anybody of choice. If a pregnant woman wants the COVID-19 vaccine, she can get it. We're no longer recommending it because there was no science supporting that recommendation.
Kennedy also recently made the controversial decision to remove all 17 members of the CDC's Advisory Committee on Immunization Practices. He replaced them with just a handful of his own picks. The ACIP's recommendations can have an impact on whether health insurance companies cover the costs.
We are all on the same page here that what is important is using evidence-based medicine to promote public health.
It's these types of changes that are leaving some families searching for answers. Lana Zach went to Illinois, where she met a family trying to clear up the confusion.
Every day is an adventure for Eunice and Anthony Perez, raising 3 children in Illinois, ages 2, 7, and 8. Their middle child, Liam, has an underlying medical condition. He was born with only 1 kidney. So confusion over vaccination guidelines is stressing their family dynamic.
Do you two ever find yourselves disagreeing about your vaccine decisions?
Yeah, right. Times, yeah, definitely. It's just not as clear as parents, right? We would wish that it was.
A recent study found 1 in 3 adults under the age of 35 is uncertain about childhood vaccines. And now state and federal guidelines aren't fully aligned with each other or the American Academy of Pediatrics.
I'm not anti-vaccines. I'm pro doing your own research. Anywhere you go, someone's telling you what to do, what you shouldn't do.
Under the Trump administration, the CDC recently stopped recommending COVID boosters for children and advised parents to consult with their doctors instead.
Where do you get your information about vaccines from?
Well, we have our pediatrician, Dr. Schneider.
We went with the Perez's as they visited their doctor.
So we haven't talked about the COVID vaccine for the kids for a little while, right?
Ann Schneider has treated the Perez family for more than 8 years.
There's been a change, right?
The science hasn't changed with these vaccines, and that's not the reason why they changed the recommendation.
Dr. Schneider told us these conversations are getting more complicated.
When your families come in and talk to you, where does it seem like they're getting most of their information?
Social media. I know that the benefits for these vaccines outweigh the risks, but I also have to respect the parents' decision.
After listening to these 2 parents' concerns, Dr. Schneider had straightforward advice.
When hearing the things that you are talking about that are important to you, then I would say yes, I would recommend the vaccine.
100% of the time, we would go to you if we have a question about it, as opposed to, word of mouth.
And in the end, the Perez parents agreed to vaccinate.
You all seem so much more reassured now. Is that fair to say?
Yes.
Even you, Zoe, you feel reassured?
Now parenting in America means not only understanding what the experts say, but who qualifies as an expert.
Lana Zach, CBS News
in Naperville, Illinois.
Now that summer is in full swing, we're all feeling the effects of warmer temperatures. It's important to hydrate and take precautions in the heat, and that is especially true for pregnant women. As David Schechter shows us, more hot days are increasing real risks for moms-to-be and their babies.
So close.
With our summers getting hotter, it's also getting harder for some pregnant women to cope with the heat. Just ask Megan Crow, who's in her 2nd trimester with her 2nd child.
All right, let's go look at the chickens.
I watch you playing. You guys are having a great time. feeling anything at all while that was going on?
Oh yeah, my stomach's already tight.
Really?
Oh yeah.
Hey, how you doing?
Good, how are you?
During pregnancy, the body loses some of its ability to regulate heat. That can lead to dehydration and, in extreme cases, early labor. Dr. Catherine Principe is Crow's OBGYN in Fort Worth.
Is that something that you ever think about?
Where we're seeing patients coming into the triage area with preterm contractions from dehydration a little bit earlier in the year and lasting in maybe a little bit later into October.
New research from the nonprofit Climate Central looked at the connection between climate change and pregnancy and found women in the U.S. now experience 12 additional extremely hot days, leading to a greater risk of preterm birth and infant mortality.
I feel like they don't have the knowledge.
Public health researcher Robin Stassen was surprised at how little heat risk information states offer for pregnant women. In her research, she found that 11 state health websites didn't have information on heat risks. 31 states and D.C. offered basic heat safety tips, but nothing on pregnancy. And only 8 states had specific warnings about heat and pregnancy.
How could states not be talking about it?
Yeah, that's a good question. I think people are now actually recognizing that heat is an issue. Climate change is happening.
Expectant mom Megan Crow says women deserve more information about the dangers they face.
So it is really concerning if things are getting worse that it's going to be harder for us to do so, to stay on top of a healthy pregnancy.
David Schechter, CBS News.
Nearly 2 years after the deadliest U.S. wildfire in over a century ravaged Maui, killing 102, the University of Hawaii has released the state's largest post-disaster health study. It shows the survivors are still struggling. Almost half remain in temporary housing, and many are facing mental health issues. Researchers have been tracking 2,000 people. Half of the adults still show signs of depression. 25% are struggling with moderate to severe anxiety, and suicidal thoughts have quadrupled since before the fire. The stress is also taking a toll on their physical health. Almost 75% of adults have elevated blood pressure, and a quarter show reduced lung function, likely due to wildfire smoke.
Healing takes time, and without sustained investment, we actually risk trauma into lifelong illnesses. So I think we are at a tipping point right now. It is a time to invest in health.
200 children are included in this study. They have also seen a decline in mental health. More than half screened positive for depression, and 45% are showing signs of PTSD. And about a third of the kids also have elevated blood pressure. A quarter of them have impaired lung function. New changes are coming that could make dealing with insurance companies a bit easier. Insurers, including United Healthcare and Cigna, are among those that have agreed to speed up and reduce the process called prior authorization.
You know, you go to the doctor, right? A lot of times they'll tell you what the fix is, what the procedure is, and then the doc goes, wait, you should probably check with your insurance company because they might not actually cover it. And so a lot of times you need what is known as a prior authorization, a pre-approval. And this has been a huge pain point for patients, providers. It takes a lot of time. It can be confusing.
Beginning in January, participating insurers will reduce the scope of claims needing prior approval. Patients can also expect more transparency on how these approval decisions are made. By the start of 2027, health plans will aim to provide a standard process for submitting electronic pre-approval requests and answer 80% of those in real time. In other insurance news, the CDC says the number of uninsured children is going up. More than 3.5 million children, about 5%, did not have health insurance last year. That's up from 2.8 million the year before. The number of uninsured adults also went up from 21.8 to 23.1 million people. These increases are partly due to the end of pandemic-era policies that expanded insurance access. During this Men's Health Month, a new survey suggests many men are unaware about the risks of testicular cancer. The highest risk group is men ages 20 to 40, and a survivor wants young men to know the symptoms. Jay Riepenhoff is a cancer survivor. He was diagnosed with stage 3 testicular cancer 3 years ago at age 29.
I noticed a lump on one of my testicles.
Jay and his wife had a newborn baby at home.
It was a shock. I definitely did not expect it to be cancer. I was really unaware of testicular cancer in general, and especially affecting men, my age.
New findings suggest more needs to be done to get the word out about the disease. According to a new survey from Ohio State University Comprehensive Cancer Center, only 13% of adults correctly identified testicular cancer as most commonly affecting men under 40.
Men are really not of the understanding that testicular cancer is a young man's disease.
The survey also found younger adults were more likely to incorrectly believe that testicular cancer symptoms are always painful. That's why urologic oncologist Dr. Sean Dason says self-exams are important for men ages 20 to 40.
You really need to check your testicle to see if there is a concern for a lump or mass and present to your medical provider if you notice something concerning, because early diagnosis is key, and this is going to result in the best outcome.
Jay needed surgery to remove his left testicle and had months of chemotherapy.
Fertility was a huge concern of ours. My wife's pregnant with another boy. We were able to naturally reproduce, so that was, very good news for us.
Jay says he's sharing his story to encourage other young men to do self-exams and take charge of their health. Coming up, the high school students who built a leg for their friend, and a look at the first hospital in the nation powered entirely by green electricity. Welcome back. It's estimated that around 2 million Americans are living with limb loss, like an amputated hand, foot, leg, or arm. Most people rely on some sort of prosthetic limb to function, but while the prosthetics available are good, they're not perfect. That inspired a trio of Texas high school students to make a better prosthetic. And as Bo Evans found out, it was for one of the best reasons.
Sam Skotnikov, Chanyeong Kim, and Ishan Dev Prashan have spent the better part of the last 18 months building this.
It's a mind-controlled bionic leg.
You heard him right, a prosthetic leg you can control with your brain.
We started with paper cups and hot glue and servo.
Using this headset, a person can make the leg move and walk.
It's a multi-node headset, it records the actual electrical frequencies of the brain.
It can also move in ways other prosthetics on the market can't.
That can adapt to different terrains,
which has massive implications for people who need prosthetic limbs. But they didn't build this to help millions of amputees. They wanted to help one of their friends.
I've had 3 open heart surgeries. I have scoliosis. I am missing a rib on my right side. I was not expected to live for the first 24 hours of my life.
Aiden Ballinger has been fighting for his life since day one. Staying alive was #1 on his priority list. Walking may have been #2. Finding friends?
No, I did not think I would have friends like this.
Friends who build you a brand new leg straight out of a science fiction movie.
And I thought down, and then the leg went down, and then I thought up, and the leg went up. And I'm like, okay, this is insane.
The boys won a $50,000 scholarship from the Regeneron International Science Fair, hosted by the Society of Science. But they didn't do it for the money or to win a contest.
And these kids, it just surprised me on how much they could put into this.
They did it for their friend. Bo Evans, CBS News, Flower Mound, Texas.
A hospital in California is making medical history, not with a treatment breakthrough, but with how it's powering its facility. Danya Backus shows us the first all-electric hospital.
Hospitals and operating rooms run 24/7, but you don't always think about how that impacts the environment.
Hospitals are high energy use intensity buildings.
That's why the University of California Irvine Health is going green. This new 800,000 square foot medical campus in Irvine is part of the first all-electric hospital complex in the nation.
We hear this term all-electric hospital. How is that different from any other hospital?
So this building's very different than a traditional medical center in the sense that we don't use any carbon fuels for our normal operations.
Joe Brothman is UCI Health's Director of General Services.
All the electricity that we use is either generated on site or procured through sustainable sources.
The U.S. health sector is responsible for 8.5% of carbon emissions in the U.S., with hospitals making a significant contribution to that number. UCI Health Irvine relies on renewable energy from the UCI grid, using electric chillers for cooling and heating instead of natural gas like most hospitals. Dr. Ryan Gibney is the medical director of the emergency room.
Our mission is to deliver, the best health care to all of this community.
He says patients may not be able to see the difference, but the effects of a sustainable hospital will be felt for years to come.
We have solar on the roofs, and we're using recycling water and really being intentional about our impact to this area as being as little as possible to deliver the highest level of health care with the minimum impact to the place around us.
Health care without harm, protecting patients and the environment. Danya Backus, CBS News, Irvine, California.
After the break, the family-run business proving capability with every car wash. And we talked to a researcher who's studying how artificial intelligence could already be affecting human brains. Welcome back. More and more college students are using services like ChatGPT to help them with assignments. A new study from MIT found these large language models, or LLMs, may be affecting students' brain activity. Researchers split 54 participants into 3 groups, asking them to write several essays over 4 months. One group used OpenAI's ChatGPT, another used Google Search, and a third used no tools at all, only their brain. The group that used ChatGPT consistently underperformed at neural, linguistic, and behavioral levels. But at the very end of the study, they found that when the brain-only group was finally given a chance to use AI, brain activity went even higher. We discussed all of this with MIT researcher Natalia Kuzmina. Natalia, you did something interesting. This study is still going through the peer review process, which we know can take a long time, but you went ahead and released it early. Why is that?
Yeah, so thanks for actually noting this, Bradley. It's very important really to stress that this is preliminary findings, not yet peer reviewed. So it's what we call preprint or working draft paper. But we felt there is a need to start the conversation. We really do not know, right, all of the possible repercussions of the technology, and it really is being almost pushed on us to some extent. And listen, we are not LLM lovers or LLM haters. It might be awesome. It might have its own set of challenges, most likely, as with any other tool we have ever introduced as a humanity. But it might be great before we just push it on everyone, understand a bit further what is happening exactly with these tools when we use them.
So your findings are early, but tell us, what are you seeing about how people's brains possibly change depending on how they use some of these tools?
Absolutely. So we actually got, a group of students from Greater Boston area, just 54. So it is really a small sample. And what we found is very interesting. So in those original 3 sessions, essays were pretty homogeneous. So they were very similar, especially for an LLM group, for ChatGPT group. But interestingly, neural connectivity was very, very different. And we found that this neural connectivity, it actually scaled down with introduction of the tools. What it meant that brain-only group had the strongest neural connectivity, but search engine, it's a tool, had intermediary, but LLM group had the weakest. So that was interesting. However, those who first did brain, so brain, and then we gave them an LLM, their neural connectivity actually was higher than in brain-only group. So it begs for a question. Is the timing maybe matters, right? Where do you introduce it? Hey, do you immediately introduce it in someone's environment, in someone's task? Or maybe should we let a student, for example, just do it themselves, by themselves, maybe using other tools, maybe no tools at all, and then let's say introduce it in the second semester of classes or something of the sorts. We do not know, we do not have any like strong conclusions to say, because it's really specific samples, specific population in specific area of the country, but we definitely think that it would raise an interesting conversation. That's why we released this preprint already.
It's a small sample size, as you've said, but do you think there's some urgency here to expand this research and look at more people?
Yeah, I do think so. And did we actually explore, again, just the timing of the introduction, right? Did we try to effectively work with the teachers and have a setup where maybe one class would be actually using these LLM tools and another would not be using them for like a semester or two, right? Did we look in any of those? We have not seen any reporting, I believe, that it has like more objective data, that actually can be maybe used to infer, okay, what would be the best way to move forward, right? And of course, it also begs for a question of, all of the content, right, that is being, of course, produced by these systems. Okay, why do we need necessarily, and again, maybe there are great reasons, but why, right? Do we need necessarily to use, closed systems, for-profit systems? Another huge secret, maybe, which is not a secret, a teacher can build, maybe with their students, a locally ran offline LLM for actually a lot of the tasks that they might be solving. You do not need any stacks of crazy GPUs, like compute in simple terms for those who are listening, to actually execute on those. It can be excellent learning opportunity. And also the students would actually learn about advantages and drawbacks of these technologies. So again, not even talking about the brain, which is huge part here. We just really going a bit in a blind way there.
All right, Natalia Kuzmina with MIT, thank you.
Thank you.
It can be a challenge for people with autism to find employment, but as Christian Benavides shows us, one Florida business is helping employees and cars shine.
17-year-old Edward Cruz says working at Rising Tide Car Wash in Coral Springs, Florida is more than just a job. It's an opportunity that's not always easy to come by.
Majority of our staff is on the autism spectrum. I'm on the autism spectrum.
People with autism experience high unemployment rates. A 2017 NIH study put it at about 40%, while other estimates show it can be as high as 80%.
I'm really proud to be here. I mean, I'm happy with what the company does. I'm happy that, what we do, it really does make a difference.
Thomas Deary and his father started Rising Tide to give Thomas's younger brother Andrew, who has autism, and others like him, a chance to thrive.
It became really clear really quickly when he was graduating high school that we were going to have to take action in order for him to lead the full adult life that we knew he was capable of. And today he has friends, he has a community of peers, he has money in his pocket where he can go buy things that he wants, and it's brought our family together.
Rising Tide has more than 100 employees across 3 locations, and more than 80% have autism.
Not only are they going to do as good of a job as any other car wash, but they're going to do a better job. They're going to exceed expectations because our team genuinely want to be here. They genuinely want to do a great job and really satisfy the customer.
Andrew says his favorite part of work is the tire shine. The car wash has become a place where he's learned valuable skills and found friends.
It is great. The customers are very nice. They give us this money.
Helping workers with their own self-esteem and washing away stigma. Christian Benavides, CBS News, Coral Springs, Florida.
Driving real change. That's Eye on Health for this week. I'm Bradley Blackburn. Thanks for joining us, and be well.